everyone. My name's Ellie McNally, and I work at Turning Point as the National Harm Reduction Lead. So this is a pre-recorded session aimed at UK pharmacies to support pharmacy teams to supply naloxone in their community. So this session is for anyone who works in the UK in a UK pharmacy, not just the pharmacist. So it could be pharmacy technician, it could be counter staff, anyone who works in a pharmacy. So this session that we're delivering is based on research which was funded by Pharmacy Research UK, and it was originally developed by our pharmacist prescriber Jenny Scott, and it was used in our original pharmacy naloxone supply scheme in Somerset. So a key priority for Turning Point is to expand access to naloxone in the wider community to make it easy to access and use in case someone does come across someone else who's overdosed. The aim of expanding naloxone provision is to prevent unnecessary drug-related deaths by making it more accessible and to normalise carriage in the wider community as well. We're really grateful to any pharmacy that's interested in supplying naloxone within your community pharmacy, and we really hope that provision of naloxone in your pharmacy can help reduce drug-related deaths. So this session isn't going to take any more than an hour, and by the end of the session you'll be able to identify the importance of pharmacy naloxone supply in your community. You'll be able to describe how naloxone works and how to use naloxone in an emergency to save someone's life. And you'll be able to supply naloxone from your pharmacy safely in a way that encourages uptake as well. So the session is going to cover some different aspects around naloxone provision, and we'll be covering what naloxone is and how to use naloxone, the law around naloxone supply, the importance of naloxone supply and carriage, why pharmacies are so important in supplying naloxone, and how to supply naloxone as well. So we'll be going through tips around that. So what is naloxone then? So naloxone is a medication that reverses the effects of an opioid overdose. Opioid-based drugs include things like methadone, morphine, fentanyl, codeine, but they also include drugs like heroin or synthetic opioids like nitazenes, which we've been seeing in our street drug supply in more recent years. So opioids are central nervous system depressants. So when someone takes too much of an opioid drug, their breathing can slow right down to a really dangerous level, to a point where they might become unconscious or they might not be able to breathe at all. When we take an opioid, basically it binds to our receptors in our brain and around our body, and it activates them. So when someone has been administered with naloxone, what it does, it's an opioid antagonist. So what it does is it works by displacing the opioid from the receptors in our brain and around our body. And then the naloxone will then bind to that receptor, and that will then act as a blockade against any opioid activity. So basically it helps the brain signals to resume again, so that person can start to breathe again. So if naloxone is used when someone is experiencing an opioid overdose, it can prevent that overdose from becoming fatal, and it'll essentially save that person's life. It should be given as soon as possible, so as close as possible to when the overdose happens, as it's more effective the sooner it's given, which is why it's really critical to have naloxone readily available for people who are at risk of overdose and for others as well, so they can carry it at all times. Naloxone is a really amazing medication, but it does only work on an opioid drug. It only works on opioid drugs, so it won't have any effect on any other type of drug, or if opioids aren't present in that person's system when naloxone is administered. If you are ever unsure if the overdose has involved opiates or not, our advice would be to just call 999 straight away and ask for an ambulance. And if there are signs of an opioid overdose, then it's better to use the naloxone kit and administer it than to not use it. as there isn't going to be any negative side effects if naloxone's used, and it wasn't an overdose involving opiates. We can't ever be sure or certain that a street bought drug, what a street bought drug contains, whether it contains opioids or not, unless it's been tested beforehand. So it's always safest to use naloxone if you suspect an opioid overdose has happened, as you could save that person's life. A really important note to remember about naloxone, though, is that its effects are only temporary. So it typically lasts for about 30 minutes. So it shouldn't be treated as a replacement for medical intervention. You should always be calling 999 if you suspect someone is experiencing an overdose and getting an ambulance there as soon as possible, because someone could come out of their overdose after 1 to 3 doses of naloxone and appear fine, but then it could be 30 minutes later, the naloxone wears off, and then that person might go back into an overdose, if the opioids are still active in their system. So again, that's why it's really important to always call 999, and really importantly, stay with that person until the ambulance arrives, and takes over to support them. Okay, so I've got a short video now that explains how naloxone works in a bit more detail, but this video is an American video, so just a side note, at the end it does advise to call 911, but obviously the emergency number in the UK is 999. So let's have a look at that.
People are dying every day from opioid overdose. Parents and children, friends and neighbors. But naloxone can help. Naloxone is a safe and effective rescue medication that reverses the effects of opioids and saves lives. To understand how naloxone can stop and reverse the effects of an opioid overdose, it's helpful to see how opioids work in the body. Opioids are agonists. This means they bind to and activate specific receptors in the body, including the brain, brainstem, and spinal cord. When these receptors are activated, people experience the effects produced by opioids, such as pain relief, euphoria, calmness, relaxation, and slowed breathing. Taking too many opioids causes so many receptors to fill and activate that breathing may become dangerously slow and even stop. This is how an opioid overdose happens, and this is where naloxone can help. Naloxone has a strong affinity to opioid receptors, more so than most prescription opioids and heroin. But unlike opioids, naloxone is an antagonist. This means it attaches to opioid receptors without activating them. So when naloxone is administered during an overdose, it knocks the opioids responsible out of the way and allows breathing to normalize. Naloxone can be administered through an injection or a nasal spray. It usually starts working within a few minutes and lasts from 30 to 90 minutes. While one dose of naloxone can reverse an overdose, sometimes multiple doses are needed, especially in cases involving extremely potent opioids like fentanyl, or opioids that stay in the body longer than naloxone. Naloxone is very safe in single or multiple doses. It may produce withdrawal symptoms in people with opioid dependence, but it has no abuse potential and cannot cause an overdose. It's important to remember that naloxone is opioid-specific. It has no effect on an overdose caused solely by non-opioid substances like benzodiazepines or alcohol. At the same time, people shouldn't be afraid to use naloxone when the cause of an overdose is unknown. If opioids were not involved in an overdose, it won't cause any harm. If opioids were involved, naloxone can save a life.
Okay, so next let's have a look at the law around naloxone. So since 2015, we've been able to supply naloxone without prescription, and this can be supplied by people. What the legislation says is by people engaged in the provision of drug treatment services, which does include pharmacy teams that provide opiate substitution, such as methadone, for example, or needle syringe programs, or you might call them needle exchange programs. In 2024, there was an amendment to the human medicines regulation around naloxone supply, which expanded the list of professionals who can supply naloxone without prescription. So before it was just people engaged by with drug treatment services, so someone working for a drug treatment service or a pharmacy providing opiate substitution, for example. But now they've expanded that list, and on that list it specifically says pharmacy professionals, alongside other professionals as well, such as probation or the police. In terms of who you can supply naloxone to, the law doesn't specify who you should be supplying it to or who you can supply it to, but there is a government guidance that suggests that naloxone should be supplied for emergency use to a person at risk of an overdose. It could be to a person who is a family member, a friend, or a carer of someone at risk of an overdose, or to anyone who's working with someone who might be at risk of an overdose. So that's who they recommend supplying it to, but that basically can be quite a lot of people. Most people will be a friend, family member, or work closely with someone who uses drugs. But I really want to emphasise that by law, anyone can carry and administer naloxone for the purpose of saving a life, and the more people who do carry naloxone, the better. Um, so our bottom line is always that you can supply naloxone to anyone in the community who needs it, and legally anyone can carry it and use it for the purpose of saving a life. So why is naloxone so important then? You've probably seen that opioid-related deaths are increasing year on year. To the side of the slide, you can also see that the most recent data from the ONS statistics for 2025, and that's around opioid-related deaths. And you can see from the graph that they're on the upward trend, with almost half of all drug-related deaths involving opiates. And I think what really hits home for me is that these deaths could have been prevented if naloxone was more readily available and more people knew about it as well. And this is where pharmacies can play a really important role in making naloxone more normalised and more available in your community. So first of all, pharmacies are really accessible. So usually they're more accessible than a drug treatment service. You're typically open longer hours, sometimes at weekends. There's a lot more pharmacy hubs than there are drug treatment services and hubs. And most people live within a 20-minute walking distance to their local pharmacy, so it's really, really accessible. And this is an even more vital point actually in more rural areas of the country, where getting to a pharmacy will likely be much easier than travelling 30 minutes plus to get to their nearest drug treatment service. Pharmacy staff also have a huge wealth of experience with people who use drugs. Pharmacy staff often see people every single day as they collect their methadone, or they attend your needle syringe program if you run one of those. We also know from our service users that they really trust their pharmacy team as well, because they've built up relationships with you every single day for the last couple of years, however long they've been accessing your service. So it's likely that they'll really trust you and be more likely to take naloxone from you because they know you really well. Pharmacies also see a lot of people who might not attend drug treatment services as well. So, for example, if your pharmacy provides a needle and syringe program, you might be seeing people who are actively injecting drugs on a regular basis but aren't engaged in drug treatment services, and that might be for a few reasons. They might not want to access drug treatment services at that moment in time, or they might not be accessible to them. But they're people who are likely more at risk of an overdose because they're unlikely to be on an opiate substitution medication such as methadone, which does act as a protective factor for overdose as well. So these people would really benefit from you offering naloxone to them. It also might be that you're more likely to see families and friends of people who are using drugs that would benefit from knowing about naloxone first of all, but also carrying it in case their loved one overdosed and they were able to then respond and save their life with naloxone. In drug treatment services, we don't always see families and friends because sometimes drug treatment can be quite private for that person and they want to keep it confidential. So we don't always see family members and friends, but you might see them in pharmacies just as they're collecting their own prescription, or if they present and they're worried about someone that they love or they care about. That's a really good opportunity to talk about naloxone as well. Pharmacies can also be less stigmatizing and low key for people to attend, especially when pharmacy staff are non judgmental and are really welcoming. Everyone goes to a pharmacy, don't they? It's not just people who use drugs. So people might feel better and more comfortable getting an naloxone kit from your pharmacy than a drug treatment service sometimes. So there's lots of reasons why pharmacy involvement is really, really crucial and why you could offer more access to people in your community so they can carry naloxone easily. So as part of Turning Point's pharmacy naloxone programme, you'll be asked to supply either the injectable version of naloxone or the nasal spray version of naloxone. And depending on the contract agreement for your pharmacy area, you might also be given the opportunity to supply both as well. But most of the pharmacies that we work with will provide the injectable version first of all. So the injectable version looks like this picture on the left. So it's a little yellow box and it's called Pronoxad. So it comes in a yellow plastic box and it contains 5 doses of naloxone in one syringe, and it also comes with 2 needles that you attach to the syringe so you can administer the doses. Inside the naloxone pack, there's also an instruction leaflet as well that tells you about the medication and how to put the equipment together. And Pronoxad is in an intramuscular injection. So it's usually injected into the outer thigh muscle or the upper outer arm muscle. The nasal version of naloxone, if you're supplying that, is called Nixoid, and that comes in a cardboard box, so that's just to the right of the screen. And inside the box there are 2 blister packs within it. Each blister pack contains 1 dose of naloxone, so within a box you get 2 doses essentially. Typically, we tend to provide the injectable Pronoxad version. Most people who use our services will be familiar with this version anyway because it's been around a bit longer. And we also tend to prefer Pronoxad because it allows for gradual dosing of naloxone by giving 0.4 doses every 2 to 3 minutes. And it can bring someone out of an overdose without that severe withdrawal symptom because of the gradual dosing. Whereas Nixoid is a 1.8 milligram dose per dose. So it's 1.8 milligrams a dose at a time, meaning that the person's more likely to experience precipitated withdrawal if Nixoid is used. Withdrawal isn't dangerous, it's not going to kill that person, but it can be really uncomfortable for them, and we want to reduce the likelihood of that happening as much as possible, which is why many people opt to take pranoxide over Nixoid, and is why we typically use supply pranoxide in pharmacies in our drug treatment services. Nixoid, however, might be preferred by some people who don't like needles or don't wish to carry needles, and it's also licensed for people aged 14 and above, whereas pranoxide isn't licensed for people younger than 18. So if your pharmacy does stock both pranoxide and Nixoid, we'd suggest being guided by the individual about what kit is best for them, but typically pranoxide is our go-to at turning point. So they're the two formulations of naloxone that we supply. So what I'm going to do now is play you a short clip on how to assemble the pranoxide, the injectable version, so you feel more confident in explaining how to assemble it when it comes to providing a kit to someone in your pharmacy.
To use pranoxide injection, remove the wrapper using the tear strip. Twist the outer plastic box to break the seals and open. Take out the pranoxide injection syringe and one of the blue needle packets. Two are supplied in case one is damaged or becomes contaminated, for example by being dropped on the floor. Peel back the backing paper from the needle packet and remove the needle, keeping it in its protective sheath. Unscrew the clear plastic top from the syringe. With the needle still in its sheath, screw the blue fitting onto the syringe. Holding the needle on the syringe with your thumbnail, gently twist the sheath and remove it. Twisting the needle sheath instead of pulling it avoids needle stick injury. Holding the syringe like a pen or dart, insert the needle at right angles into the outer thigh or upper arm muscle, through clothing if necessary, and inject to the first black line to give a 0.4 milliliter dose. Withdraw the needle and put the syringe with the needle still attached back into the cradle of the pranoxide injection case. If you need to give another dose, insert the syringe again near or around the same site and inject to the next black line. After using pranoxide injection, keep the syringe in the box and hand it to the ambulance crew so that they know it's been administered.
Okay, so when you're speaking to someone about how to use pranoxide, there's some key things to remember to discuss. So we'd always recommend telling the person to call 999 if they suspect an overdose. Put the person in the recovery position if they're breathing, and if they're not breathing, that's when you'd start CPR if you know how to do it. When you administer naloxone, you're going to be administering it to the outer thigh or the upper outer arm muscle, and remind people that it can go through clothes as well. You don't need to undress someone to administer naloxone. You're going to administer one dose of naloxone every 2 to 3 minutes until the individual's breath improves or returns, and you want to stay with the person until the ambulance arrives, if it's safe to do so. And if the person does go back into an overdose, that's when you can use another dose of naloxone if you have more doses to use. So with Nixoid, all you have to do to prepare it is take it out of the blister pack and insert it into one nostril. And then once it's in place in the nostril, you'll then press the plunger until you hear a click. And that's how you know the medication has been administered. You don't need to prime the plunger because it's really sensitive. So if you prime it before you get the dose into the nostril, you could waste that dose. So here's a video on how to use Nixoid.
Check for signs of an overdose. Call the person's name or shake their shoulder. Check their airways and breathing. Call an ambulance. Always call 999 straight away. if you think someone is experiencing an overdose. Give 1 spray of naloxone. With the person on their back, place 1 hand under their neck and tilt their head gently back. Insert the spray into a nostril and push till you hear a click. If the person is breathing, the 999 call handler may ask you to put them in the recovery position. Put them on their side in the recovery position if you know how. Stay with the person until the ambulance arrives. If the person is not breathing, begin CPR. If the person hasn't responded after 2 minutes, give a 2nd dose of naloxone. Give them space when they wake up. Explain what has happened and that you have given naloxone. When the ambulance arrives, inform the paramedic you have given naloxone. Give them any used sprays to dispose of.
And like with naloxone, there again are some key steps to cover when you're talking to someone about how to use it. So again, always recommending that they call 999 if they suspect an overdose, putting the person into the recovery position if they're breathing, and if they're not breathing, starting CPR if you know how to do it. Administering 1 dose of naloxone every 2 to 3 minutes into the nostril until the individual's breath improves or returns. Stay with the person until the ambulance arrives if it's safe to do so. And if the person goes back into an overdose, then use another dose of naloxone if you have it. So now you know how to use naloxone, it's also helpful to know what an opioid overdose looks like. So here's some key signs of an opioid overdose so you know what you're looking out for. So someone who's experiencing an overdose will be unconscious and unresponsive. So they won't be responding to touch or sound. So I would always suggest shouting the person by their name, if you know it, or shaking their shoulders to see if there's a response. The person might have really shallow breathing, or they might not be breathing at all. They might be experiencing cyanosis, which is blue or grey tinges to your fingertips or your lips due to the lack of oxygen. They might have pale or ashen skin or a pale or ashen complexion. You might hear rasping, snoring, or gurgling sounds coming from them as well. But these are the key signs we tend to see, but I want to make a note that overdose symptoms do look different in different people. So for example, someone might have all of these signs, or someone else might just have 2 of these signs. So they might be unconscious and have slow breathing, but they might not yet have pale skin or be experiencing cyanosis. But even if you spot one of these signs, such as someone being unconscious and unresponsive, you'd be on the phone to 999 and preparing your naloxone in case you need it. Okay, so that's how you recognise an opioid overdose, and hopefully now you feel a bit more confident with how to administer naloxone in peroxide or Nixoid form. So how do you actually offer and supply naloxone in your pharmacy? So we've got some tips on how to make an naloxone offer in the pharmacy, and these tips have come directly from the research and evaluation conducted a few years ago with pharmacies who were supplying naloxone. So the first tip is about being proactive. You need to be actively talking about naloxone and asking people if they want it or if they need it. Don't wait around for someone to ask about naloxone, because most people won't do that. Some people might not know what it is, they might not know that you supply naloxone in your pharmacy, or they might feel embarrassed to ask about it. It might just not be on their mind to ask about it when they come into the pharmacy as well. They might have other priorities, such as getting their methadone or getting their needle syringe equipment. All sorts of things might be a reason why they haven't asked about it. So you making that offer can be really helpful to trigger that conversation. The second tip is to link your offer to a related service. So for example, if someone comes in and asks for needle exchange, you could also offer naloxone at the same time, because it's a related service. It might be that someone just comes in for their methadone as well, or their buprenorphine. Typically, someone who's prescribed methadone or buprenorphine from our drug treatment services would have already been offered naloxone and usually be in receipt of naloxone as well. But there's no harm in asking them if they have it, because it might be that they've lost their kit, maybe it's expired, they've used it and they need a replacement. So just asking about it can act as a reminder for that person to have it on them, or to get a new kit. And as well as that, you asking just shows that you care about them and their well-being as well, which in turn might help to build more trust, and build better relationships as well. Our third tip is to keep it brief. So it shouldn't really take any more than 2 to 3 minutes to cover the basics of naloxone. And often people don't have a lot of time to be waiting in pharmacies for 10 plus minutes to go through to the consultation room and go through the ins and outs of naloxone and how to put it together and how to use it. But as well as that, pharmacies are also really busy places as well. So it's beneficial to you and the service users to keep it as brief as possible. Most people you meet will likely already know how to use an naloxone kit, so you will likely just need to cover the basics and provide them with an information leaflet about how to use the kit, and that should be enough for them. We also want to encourage you to prioritise supply of naloxone over giving detailed instructions on how to use it. People I know it sounds really basic, but people can't use naloxone if they don't have it. So we want you to prioritise getting naloxone into the hands of people who need it, rather than making people wait for a long time to run through how to use it and go into the consultation room. It's a really safe medication to use, and each naloxone kit has a patient information leaflet as well. And we also provide pharmacies with a tear-off leaflet for peroxide if you want it. So you can then supply that to people, which tells them how to use the kit step by step. So yeah, it doesn't need to be long. Keep it really brief, and as bare minimum, you can give them the information leaflet that tells them everything they need to know. Tip 5 is that resupply can be even quicker than initial supply. So if the person has already had naloxone before, it could just be the case of you asking them, do you remember how you use it? Do you have any questions about how to use naloxone? And then maybe giving them a gentle reminder to remember to call 999 if you have to use it. And that they can come back at any point for another one, for another kit. And then a really important tip is about being non-judgmental and discreet in your naloxone offer. So like we said before, we don't need you to make a supply in the consultation room. You can if it's free, but we don't need you to make people wait 10-15 minutes for that consultation room to be free. There's always ways to make a supply discreet, without going into the consultation room, and you could offer it over the counter in a really discreet and respectful way, and that can be really crucial to making that successful supply as well. Lots of people don't have time to go into the consultation room but still want it to be done in a respectful and discreet way. And top tip from us is to have an naloxone kit with you in your hand when you're making an offer. The person might not know what naloxone is by the name of it, because people call it all sorts of different things. You know, in America, people call it Narcan, and you get a lot of people in the UK thinking it's called Narcan here as well. But they might know what it looks like, so having it in your hand whilst you're talking about it, the person might put two and two together and recognise what it is. The person might also be more likely to say yes if you have it on you there and then, rather than you having to go back into the back of the shop to find a kit. And that can make it easier and quicker for you to supply it to that person. So when it comes to making an offer, we have some suggested phrases to get you started. We're not teaching you to suck eggs. You'll be able to work out what works best for you and what are your go-to sort of phrases and conversation starters. But here's just a few examples. So you might want to start off a conversation with simply, do you have an naloxone kit, and showing them the box. And if they say yes, I've already got one, thank you very much. You might want to then carry on the conversation and just say, is it in date? Do you have it on you? Because many people will have an naloxone kit who we support in our treatment service, but it might be that it's expired, or they might not carry it with them at all times when they need it. So it's always worth checking if it's in date or if they have it on them. Or you might want to start a conversation by letting people know that you're now supplying naloxone. So like I said earlier, someone might not know that you've started supplying naloxone in your pharmacy. So starting a conversation like, we're now supplying naloxone. Do you know much about naloxone? Have you had it before? Would you like to take a kit away with you? But like I said, as you start to supply the naloxone yourself and you get that practice in, you'll get more comfortable with what approach you're going to go with and what works best for you and the people you're supporting. So if someone does accept your offer of naloxone, all you have to do is simply ask them if they know how to use it. If they say yes, that's brilliant. I would just then ask them if they have any questions about how to use naloxone, and then remind them to call an ambulance if they need to use their kit, and encourage them to have it on them at all times. If you offer a naloxone kit and the person accepts, but they don't know how to use naloxone, you'll need to provide them with some brief advice on how to use the kit. So that will involve how to use the kit, how to get a new kit, any signs of overdose, and if they are in a rush and they don't have a lot of time to talk through that with you, we'd recommend, again, prioritising supply, and then giving them the tear-off leaflet instruction with their naloxone kit, so they can have a look at what they need to do in their own time as well, because that instruction leaflet tells them step by step what you need to do with your naloxone kit. So what happens if someone says no? This does happen, and it can be for lots and lots of reasons. It might be that the person doesn't think that they're at risk of overdose. It might be that they don't want to discuss naloxone or overdose with anyone due to fear of judgment or embarrassment. They might just think that they don't need it because they don't use drugs. But each refusal of naloxone could be a really good opportunity for you to have a conversation about why it's important to carry naloxone, and unpick some of the myths or the concerns or uncertainty about carrying it, so you can support that person. If people do refuse naloxone, don't take it personally, but just by you asking the person about naloxone, you're already doing a really great job in opening up those conversations. So responding in a friendly and non-judgmental manner can really encourage that person to come back at another time to get a kit, or remember actually that pharmacy, they do kits now, because that person was talking to me about it last time I went in, so I'll go back there. But there's lots of different ways to close a conversation if that person has refused naloxone. So again, being really friendly and welcoming. If you change your mind, you're welcome to come back at any other time and come and get a kit. You might want to remind them that their local Turning Point or drug and alcohol service can give out a kit as well. Turning Point also offer a free home delivery for naloxone, so we can provide you with posters for our click and deliver naloxone scheme, or little cards. If you do need that, please just contact us, and we'll send them out so you can display them in your pharmacy. Or you could be a little bit more brutal around it, or a bit more direct, should I say. Please have a think about it. Overdose rates are getting higher and higher. We're trying to stop people dying, so please come back if you change your mind, something around that. But again, as you gain more experience, you're going to feel more confident to challenge a refusal and have a better conversation about why someone's refusing it, and like I say, unpick those myths and concerns around it. So what we've gone through is just some suggestions of how you can have a conversation, but you will pick up your own ways to have your own conversations to make it work for you. But what we've done is we've put some examples together of how to supply naloxone, how to supply it if someone's in a rush, and how to respond if someone says no. So we've put them all on YouTube, so please feel free to have a look at them in your own time, because they might be helpful for you to see how those conversations might go in practice. So coming on to suppliers and payment then. So exchange suppliers are our suppliers for naloxone provision. So you might already have an exchange suppliers account if you already run a needle syringe program in your pharmacy. So if that's the case, you'll likely order your naloxone directly through your exchange supplies account, or you'll be set up for auto order through Neo if you record your transactions on Neo rather than Farm Outcomes. But if you're unsure on which method of ordering you're going to be doing, please just speak to your Turning Point rep and we'll clarify that with you. So ordering through exchange supplies or through the Neo account, which we'll set up, means that you don't have to pay for that initial supply of naloxone and claim it back. So we will pay for that initial supply of naloxone, and then you'll get paid for every naloxone kit that you then supply to a service user. It's really important that each naloxone supply is recorded on the system that you record your transactions on. So you'll either be recording on Farm Outcomes or you'll be recording on Neo. If it's not recorded on there, you won't be able to claim the agreed price for the transaction. But once it is recorded on there, that's when you'll get paid. If you are also on the Neo auto ordering system, when you log your transactions on Neo, once it gets down to 2 or 3 naloxone kits left in your supply, Neo will auto order more stock for you, so you don't have to manually order it yourself. But if you need any more information on that, please do ask our pharmacy team and we'll clarify how to do it for your service. There is an agreed price per transaction for each naloxone kit that you give out, and it's agreed locally with your LPC. And the prices will be stated in your contract that you sign, your service level agreement. So just a little bit of information about how you add a transaction on Farm Outcomes. So you'll log on to Farm Outcomes as you usually do and find the person that you're working with, and a naloxone provision tab will be added to your Pharm Outcomes account. So it will ask you if naloxone has been supplied or no. So if you are supplying it, click yes, and then it'll ask you for the amount of naloxone kits that you've supplied. So if you're supplying 2, put 2. If you're supplying 1, just put the 1. And then it'll ask for the batch number and the expiry date of the kit. So they can both be found in a little white label on the side of the Pronoxide kit or the top of the Nixoid kit, and it says LOT and then expiry date underneath. If you work on Neo, this is how you add a transaction to Neo. So you'll log into Neo as normal, and you'll click your transaction site, which will be your pharmacy site, the transaction date. So you can backdate it as well. So if you made a transaction yesterday, but you're logging it today, you can change the date and you can add the time in. You'd then search for the person, so you'd select their gender, put their initials and their date of birth in and click find. If the person isn't set up on Neo already, you click new and you just add them with their initials, date of birth and their gender. If someone is refusing to give you any details, we don't want that to be a barrier to you supplying naloxone. So on Neo, there is also an anonymous button, which will be right next to the new button. It's just not on this example. So you can log it as anonymous as well. So once you've searched for the person on Neo or you've added them to Neo, it will then bring you out to the naloxone provision page. So this is at the bottom of the page, and all you have to do is tick this box here. So this is just saying that you've provided the person with a leaflet around Pronoxad. In the next box, you're just going to type in how many Pronoxad kits you've supplied during that intervention, and then the box at the bottom here, you just need to tick it to confirm that you've entered the batch number and the expiry date into the notes section, which is here right at the bottom of the page. And again, the batch number and expiry date can be found on the side of the naloxone kit. And then click save, and your transaction will be saved and you'll get paid at the end of the month for any transactions that you've made. So just in summary, we want you to think about naloxone supply more of a counter sale than a detailed intervention. You don't have to go into the consultation room. As long as it's discreet, it can be done over the counter, and it should always be a quick interaction. If someone doesn't have time to stick around, give them the leaflet and advise that they need to call 999 if they are to use the naloxone kit. Try and hook your offer of naloxone to another relevant service, such as needle syringe program or methadone or buprenorphine, because they're likely people who will need naloxone more than anyone else. You can supply to families, carers and other people, but discretion is definitely needed when working with people, working with families and friends. Any member of your team who's completed this session, watch this session, can supply naloxone. This means that supply doesn't rely on a pharmacist being present and available. Anyone in the pharmacy team can supply it as long as they've completed the session. And just as a bit of reassurance around that as well, our staff at Turning Point, all of our staff are able to supply naloxone without prescription. It's not just the doctors or nurses or pharmacists that we have on site. Anyone can do it as long as they're trained to do so, and we find that it works really well and makes naloxone really easy and accessible to give out. If you do want a dummy kit for Pronoxide, we can supply that as well, so just get in contact with your Turning Point rep, and we'll be able to get that sent out to you. And please stay in contact with us as well. We'll be in contact with you on regular interventions to see how your naloxone supply is going and if you need any support. But don't wait around for us to get in touch. Please feel free to get in touch at any point if you have any issues or concerns, or you just have some feedback around the scheme. Please do get in touch. So next steps, first of all, is to make sure you can access your NEO or Farm Outcomes account and make sure you know which one you're using. Clarify how you'll be making the orders of naloxone with your Turning Point contact. So are you going to be on NEO auto order, or do you need to order them through the Exchange Supplies web shop account? Ask for a naloxone demo kit if you need it, and then you can start giving out naloxone. If you haven't by this point, if your pharmacy by this point haven't signed their service level agreement, you will need to do that as well. And if you're unsure whether that's been done yet, please do contact Turning Point's pharmacy team and we'll make sure that's done. But just some last tips to leave you with. Make sure you have at least one naloxone kit in stock at all times. If you're on NEO auto order, it will do it automatically for you anyway, so you won't need to think about that too much. But if you are on Farm Outcomes, you will need to order your own stock in. Make sure your stock has at least a year's shelf life on it, and if any are due to expire, destroying them appropriately and disposing them appropriately. Advertise that you now offer naloxone, so we can provide you with posters, or your pharmacy might have their own poster for supplying naloxone, but if you need that, please do ask. Keep offering it periodically as you feel appropriate. Someone might say no at first, but if you offer it in a week's time or 2 weeks' time, they might change their mind. Just because someone said no once doesn't mean they're always going to say no. Watch the example videos as well. So it gives you an opportunity to see how you can have conversations around naloxone and practice with each other as well. If you're feeling a little bit nervous about offering it, practice with your pharmacist or your pharmacy teams and colleagues to see if they can give you some feedback on it. And ensure that all staff know what to do if someone asks for naloxone in your service. So it might be that not everyone attends this training, but make sure they know who can supply naloxone in your pharmacy, and if they want to also supply naloxone in their pharmacy, then to watch this video or attend an online training session with us. So just some extra information about additional support. So what we'd recommend is consider appointing a pharmacy champion in your pharmacy. So that's someone who can really promote naloxone with your team and make a bit of a competition out of it. A pharmacy champion, however, is not the only person that can give out naloxone. Again, anyone who's done this training can give it out. It's just someone who can really encourage the team to keep on top of naloxone provision. Regular training is really important. If you ever need a refresher or the staff team need more training, please just let us know and we'll arrange that. And ongoing support and pharmacist leadership is really valuable. So it's really important to demonstrate as a pharmacist that you're behind naloxone provision and you're encouraging your teams to do it. If you need any support from Turning Point, you can contact myself if you have any questions about naloxone itself or about training. You're welcome to contact me, and my email's on there. If you have any concerns around contracts or ordering or anything like that, you can contact our pharmacy team at pharmacy@turningpoint.co.uk. And then we just have some further learning and resources as well. So we've linked in there a link to some naloxone e-learning, the 2025 updated guidance on naloxone supply in the UK, and Turning Point also have an overdose awareness page on their website which talks all things overdose awareness and naloxone provision, so feel free to look on there if you need any more information. Just some resources to have in your pharmacy. So these are things that we can send out to you if you need them. So we typically send out a naloxone window sticker with your first order. So you can pop this in your window to advertise that you're now offering naloxone. We can provide you with some naloxone posters if your pharmacy don't want to make one yourself. again, to just advertise that you're offering it. We can also provide naloxone guides that can be sent out directly to your pharmacy, and Turning Point also offer a click and deliver service. So that's a delivery service for naloxone which is free and gets naloxone directly to someone's door. So we can provide you with posters and cards around that as well, if you think that would be useful in your pharmacy. But that's it from me. If you have any questions at all, please feel free to get in contact. And I just want to thank you from everyone at Turning Point for the work that you're doing to reduce drug-related deaths in your community. Thank you very much.